Welcome back to Kitchen Table Care Chats. Today we're joined by Jan Seeley, Chief Executive Officer of the New Brunswick Special Care Home Association and a respected leader in long-term care who has dedicated decades to improving the lives of seniors and vulnerable adults across New Brunswick. Jan has not only advocated for the sector at the provincial level, but has also spent nearly 30 years as an owner and operator of a long-term care home, giving her a unique perspective on both policy and frontline realities. Over the years, Jan has become a leading voice for special care homes, working alongside government, healthcare partners, and community organizations to improve funding, education, standards of care, and workforce supports. Her advocacy has helped drive meaningful change for thousands of residents and care providers across the province. In this episode, we talk about the realities facing special care homes today, the progress that's been made in the sector, ongoing challenges, and what the future of long-term care could look like in New Brunswick. Jen also shares insights from her years of advocacy and leadership, offering a candid look at the work being done to ensure seniors receive the dignity, support, and quality care they deserve. Pull up a chair and join us for this important conversation with Jan Seeley.
This Kitchen Table Care Chat is proudly brought to you by Surge Learning and CareLink. Surge Learning supports care teams by keeping staff engaged through career development, accessible policies, and clear insight into learning and performance trends. The focus is on helping teams feel confident, supported, and prepared in their roles. CareLink connects healthcare professionals directly with facilities, offering a flexible and efficient way to fill shifts with trusted, qualified staff. By simplifying staffing, CareLink helps teams focus more time on care and less time on coordination. Together, Surge Learning and CareLink support the people and systems that keep care moving forward.
Hi, Jan. Thanks so much for joining us today. We're really excited to have you.
Oh, you're welcome. I'm happy to be here.
Fabulous.
Yeah.
Can you tell us a bit about yourself?
Sure. I'm the CEO for the New Brunswick Special Care Home Association, and I was an operator of a special care home, two care homes actually, for 30 years. I recently retired in December, and I'm also one of the three members of the Long-Term Care Alliance alongside the nursing home group and the home support group. And yeah, so it's keeping busy in the long-term care field for
I was
sure.
going to say that's a lot.
That's a lot.
Yeah.
Can you tell us a little bit about the Long-Term Care Alliance and what that is?
It's we signed a memorandum of understanding a couple of years ago with Richard Lausier, who was the CEO for the Nursing Home Association, and Tina Learmont from Home Support. And it was really an opportunity for the main providers of long-term care to come together and recognize that we all had many similar issues, and how can we collaborate with government and ensure that the people that are delivering those frontline services are listened to, and that we actually can make a difference, because all of us want safety and security for our seniors and our folks with different mental health conditions and so on to receive great care. So even though we provide different, we have different names, at the end of the day, we're serving people that are vulnerable and need care. And we had a lot of similar concerns and ideas. So government was happy when we formed the alliance and got an opportunity to work to create the long-term care plan for seniors.
That's amazing.
I think I've seen you three on stage. I don't know if it wasn't this year, it was maybe the year before. Were you guys at the Fredericton Nursing Home Association and you guys were on stage?
Yes,
Yes,
yes, we
I
did a
actually
panel.
you
Yeah.
did a panel. Yeah, I do remember. And you guys just like bounced off each other like so naturally. And yeah, that was the first time where well, not met you, but virtually saw you. But you guys were
Yeah.
fantastic. Like, and like, just like your energies between all three of you guys, I feel like, yeah, it's no doubt that they have a really good alliance.
It's, people think you stay at home when you're still somewhat independent and you need a little help with this and that, and then you move into a care home when you need a little help with this and that, and then you move in. That's not the reality. The
No.
reality is there's people staying at home that have very complex conditions and require a lot of support. And thankfully, we have home support agencies across the province that can, rise to the occasion and meet those needs. And some people can stay at home with what someone would say are nursing home needs, but they have a large family. They have,
Hmm.
their environment is conducive to their condition, and they have a lot of support, and they can stay home. And then you have people that don't have that might have to go directly to nursing home because they need 24-hour nursing care and they have a
Yeah.
lot of mobility issues. And then you have a whole bunch of people in the middle that live in special care homes. So our 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 goal really was to not talk about as an alliance, not to try and jam people into boxes of services, but to wrap services around people and help
Hmm.
them to stay in the place that they hold dear as long as possible. So
Yeah.
aging in place is a huge focus of the Long-Term Care Alliance.
Yeah.
That's
Yeah.
great. And how do special care homes operate in that scope? We don't have special care homes in Nova Scotia. We have different levels of care. So what does that look like?
Well, we have over 400 special care homes in New Brunswick. We have three levels. One is level two, which are people that things have started to break down at home and they don't have those supports and they need more care and support. And some people are seniors that are struggling with mobility, some dementia, and all of those things. Others are younger people. I mean, I had a resident that was 19 and I had a resident that was 101 at the same time.
Wow.
And they got along great and it was a wonderful, they lived like a family. I mean, my home was very small. I only had 12 people. But so you have people that have a broad range of needs that would fit into that special care home space. But we also have, so that would be level two, and then we have memory care homes, which they do have in other provinces, and that's for people with moderate to severe dementia that also have a risk of eloping or escaping.
Hmm.
And they might have also some maladaptive behaviors that require staff to be more sensitive to and more equipped with dementia training. Like, for instance, if somebody has lost their purse and they feel they've lost their purse and they're going to the staff all the time. Well, you can imagine that would if that was just staff that were busy with everyone else and trying to deal with someone that has that type of behavior and didn't have the training, that could be very difficult on the other residents because
Hmm.
you only have so many staff. But with memory care homes, the staff have, specific training on that. So it's homes that are only 18 people or less. They have a 1 to 3 staff ratio. So I mean, it's
Hmm.
amazing.
Wow.
New
Wow.
Brunswick,
That's
New
amazing.
Brunswick should be yelling from the rooftops about that level of care. It is
Oh
a
my gosh.
specialized level of dementia care, and we need more homes. And the people on the wait list, the data doesn't lie. We need more of those homes, but unfortunately, right now in the province, we don't have a bed plan. And I hate calling it a bed plan because really it's spaces for people to live.
Hmm.
I hate the word bed, but anyway, we really have a need, and the across the province in different regions, government has those numbers. So we're anticipating something to be announced soon that will say, okay, in Petitcodiac we need this many, in Moncton we need this many, in St. John we need this many, because dementia is not slowing down.
No.
So it's an excellent model. It's fantastic. There's some things we need to do to tweak it to make sure staff get paid better and all of those things. But the idea, the concept behind the model is fantastic. I mean, you can imagine if your loved one had advanced dementia and was trying to escape and went to a home that maybe has 100 beds or 150 people living in it. That's a lot different than going somewhere where there's 18 people living and there's 6 staff on the floor.
Yeah.
So,
Yes.
yeah,
Yes.
we're very
Are all
proud
the
of that.
homes are all the homes like smaller? All the special care
The
homes?
majority of homes in New Brunswick are, most of
Okay.
them are 10 beds or less. And I hear I say
Wow.
beds again, but I don't know
I
what
saw.
else to say.
Well, I
Uh,
actually, sorry to interrupt, but I had this conversation recently, and they didn't want it to call it beds, and they called them residents because it is
yes,
residents, right? Opposed
yes,
to the beds. Yeah, because
yes.
they're
Well,
persons.
that's right. We'll use that. So there's about 288 homes that are level two that would take
Okay.
care of about 5,400 people right now. We are actually special care homes take care of the largest chunk of
Yeah.
long-term care residents that live permanently in a place other than their home. And then we have about, I'm just guessing, I forget the latest numbers, about 30 homes that are memory care and about
Okay.
20 that are what we call generalist care, and that's 3G. I know it's difficult when you think you want to buy a chocolate bar and there's like 10 different kinds. It doesn't help when we have
Yeah.
all these different levels, but 3G is for persons that their mobility is much more of a challenge.
Okay.
And they might have two or three different conditions, like they might be on oxygen and they need assistance with insulin, and they're also maybe have some incontinence issues. So they've elevated to a place where, they're almost nursing home, but they don't need a nurse available to them 24/7 in the building. And they're still able to usually transfer themselves from the bed into a wheelchair, let's say.
Mm.
Special care homes, a big differential there is we would not generally admit someone that is non-ambulatory and is bedridden. That
Mm.
would be somebody that would go to a nursing home. Other people go there as well, but that's
Right.
a
Mhm.
that's a difference. So we have level two, we have memory care, and we have generalist care, or 3B and 3G.
That's
Oh.
amazing that the ratio for that is 1 to 3 when they are more mobile and able to get around. How did that come to be, or do you know any of the background?
Yes, I was involved actually. Sue Stoltz was this social development minister at the time, and this model had been working very successfully in Moncton since the early 80s. And then they decided they wanted to kind of separate it and have homes for Alzheimer's and dementia and homes for frailty. So that happened, and the funding didn't support it. At that time, we were supposed to have 712 beds. That was back in, I'm going to say 2012, 2013, maybe. And still, we only have 500. So there's
Mm.
some things that need to happen. I mean, if you're going to put six people on the floor, the funding needs to follow that.
Yeah.
So, but it's not actually, I mean, they are specialized units, specialized homes. They're not a nursing home. They're not a level two special care home. They are a unique, fabulous model. So we've made a lot of progress with ensuring that the model can be sustainable. But we still have some homes that, because of the funding that comes from government, they've had to charge a little extra because they want to pay their staff a little extra. So that can become a barrier for some.
Mm.
So we're working on
Got it.
that.
Very cool work, though. Very, very
Yeah,
interesting.
it is. Yeah.
We've been talking a little bit about in 2024 about an incident that happened regarding elopement. And we've heard you speak in the news to that. We were wondering if you could tell everyone a little bit more about that and what's come since.
Yeah. That I was involved with that actually. The operators reach out to us when when they need help, and that was a terrible tragedy. And it was not about the failure of the frontline staff providers. It was a failure of the system. The system has the mechanisms and the policies and processes to respond, but it did not in this instance. There's policies within the Department of Social Development that when their care needs are increasing and they don't have a place to put them right away, there's policies designed to wrap services around that person and ensure that they can stay safe. So I'm speaking of like additional hours of care,
Mhm.
monitoring devices, and that report, which was very hard to read, was about how the system failed. And, people could blame the workers, the operators, the social workers, but Kelly Lamrock was very clear it was not a failure at the frontline level. And it was not about people not caring.
Yeah.
Many people cared about Alice. And for your listeners, I want them to imagine, and, if let's take my 12 bed special care, my 12 person special care home. If we had a person, and we did over the years, we've had people that their dementia advances and they'd start to go to the front door a little bit each day. And then it's like, oh, come on over here. We're going to go play cards or let's go do some
Mhm.
exercises or maybe we'll go for a walk. But then they start to go out the door. And special care homes in level two, which there's almost 300 of them, generally, we don't have the coded systems on the door.
Right.
So, you do some creative things, you have wind chimes, you have tracking devices, you do that type of thing. But in those days, when I had people that had those types of problems, we didn't have policies to reach out to. And
Mhm.
today we do, but unfortunately, they're not applied consistently across the province. And as much as we try to share them with our members, operators sometimes don't even know, but they do. They send in incident reports and they say, this person is leaving. And so back to my initial comment about the effect on the entire home, because if you're Bob and Sue and Jane sitting there and you live there as a resident, you're concerned. Oh my gosh, there goes Alice again, and
Yeah.
somebody get her quick. So and the operator, I mean, you can barely sleep at night because you're worried that just at this inopportune time, and it might be, there's interventions you can do, but they're not fail-safe like a secured environment is.
Mhm.
So, if maybe Alice was someone that went at 3 o'clock and went to the grocery store, maybe you can come up with
Mhm.
some ideas about how to redirect her energy and give her some extra time around that. But you're doing that with only the staff you have on your normal ratio. What needs to happen and what can happen is that extra staff can be applied to help to keep Alice safe
Right.
until there's a secured environment found for her. And really, for special care homes, the elopement, the wandering, the escaping, whatever word you want to use, that's a deal breaker. And because we can't keep people safe like that. And the
No.
other is when they become bedridden.
Yeah.
Because even though we have sprinkler systems and all of that, our buildings are not built exactly like, they're not, you don't keep someone in one wing and there's a cement wall there. We have fire doors, we have sprinkler systems, we have all of that. But so anyway, the system failed. If I was in charge today, I would be identifying. I know we have 194 people in special care homes that are waiting in level two special care homes waiting for a higher level of care.
Oh, wow.
Around 70 of
Wow.
them are waiting for memory care. So there's 70 Alices out there. If it was me, I would be getting in contact with the social workers for those residents immediately and
Mhm.
having a meeting with the operator and the family and saying, listen, what can we do to ensure that
Yeah.
this doesn't happen again? And I can only imagine that those conversations are happening. We're certainly pushing for that.
Yeah.
I'm so sorry to hear that happen. That's really difficult.
Yes, I mean, they found her 10 times,
Yeah.
and it was, I think, 11 times. And then the 12th time they couldn't find her. But they waited a year. I mean, I can pull up those policies in 2 seconds. And, but I know people even today that have had difficulty getting extra hours. So this is a major priority of ours right now. We're pushing hard on government to
Good.
educate your frontline staff, educate the operators, get these policies out. I know everyone's over budget. I understand that, but we're talking about, keeping people safe. And, if it was a child, I think they'd be all over it. So we need to do the same.
Yeah.
It's
Absolutely. That's a really hard thing to navigate too. Have you seen any changes that are obvious to you right now, or
for the better, you mean?
Yeah.
both?
Well, yeah.
Yeah.
Yeah. Yeah, well, one thing that's happened now is that in all special care homes across New Brunswick, we have extramural nurses attached to every single resident. So there's of all 7,500 residents, every one of them have received an assessment from EMP. At some point in time, they've been enrolled into the EMP program as they move into the care home or they've been living there and EMP has just up enrolled that home. That's fantastic. We are now special care homes are
Mhm.
not just about room and board. Like we are a pivotal part of the healthcare system, and we're delivering. very important, healthcare services. And now we have these nurses attached to every resident. So when a resident, say for instance, a resident moves in and they're diabetic and they need assistance with insulin because they're blind,
Hmm.
these EMP nurses immediately are meeting with the staff, training them on insulin, showing them how to take care of Mrs. Smith so that this is done properly. We didn't have that before. We had operators, some of our operators, many of them are nurses, LPNs, PSWs, doctors even. We've provided great care, but this has been an enhancement that is a game changer, because we're now able to call. If I had a resident that moved in tomorrow, that had those needs I mentioned, I would call the EMP nurse and I would say, "Could you come in this week and get us acquainted with Mrs. Smith's needs?" And they would do that immediately, and
Okay.
all staff would be aware of this, that, and whatever to watch for. And then if anything changes in that person, we used to before, we would say, just, we'd take her blood pressure, things aren't quite right here, and, what's going on? And we would call 911. Well, now we call
Mm.
EMP. And EMP either does a virtual visit or they do an in-person visit. And if they
Oh.
feel it's necessary, they also have a physician available now to connect to all of these residents, and the physician will do a virtual visit and say, "You know what, I think you should adjust the insulin, or I think you should call 911." And, so it has drastically reduced the need for our residents to go to the hospital, which is really important. We know the mess the hospital's in now. Imagine what it would be like. This program's been in place for 2 years.
Wow.
So
That's great.
but back to Alice, the EMP nurse, um, it's not just the operator that's calling the social worker and leaving messages because the social workers have too many cases. We know they're not properly resourced. The EMP nurse can escalate it,
Oh, wow.
and they get the
Okay.
doctor involved. They call the supervisor of the local regional SD department, and then they're like, "You know what? Jan can't do this anymore. Mrs. Smith is running out the door. We need immediate hours of care." And I've heard of cases where people have been given 24/7 additional
Oh,
hours of care to watch somebody, and then they escalate them to the top of the nursing home priority list, and then they get moved. I mean, our goal is not to move anybody. Our goal is to provide as many services as we can, right up to palliative care, and have people stay and they get used to the staff. Like you can only imagine, you're someone that needs assistance with bathing and dressing and incontinence needs. Who wants a revolving door of people to do that? You rely on these staff. They become your family.
hmm.
So if you can stay there until your last days, I mean, that's fantastic. And I know in the past in our home, I mean, I remember my daughter who owns one of our care homes now. I remember her laying in bed, kind of holding a gentleman as the nurse was there, and he took his last breath, and like he didn't want to be anywhere else.
Oh,
And he was actually able to pass away there, and we had several other people as well. So people don't want to move. People don't want to go to the
No.
hospital, let alone wanting to move like all their stuff and go. Imagine, even as a senior in the community, to reach out for help. That takes a huge step. I mean, our
Yes.
generation, well, not our, because you guys are younger than me, but your generation might be quicker to pick up the phone and say, "I'm aware that you have procedures that can help me." But seniors of today that are in their 80s and 90s, they're very proud and they're not quick to reach out and
No.
actually say, "I need help."
No.
So when they do that, don't make them, travel through a system that says, "Sorry, you don't fit here. You got to move here. Sorry, you don't fit here. You got to move here." Wrap services around people and create levers that operators and caregivers can use, and they're readily available to them and they're aware of them. And when they need them, they're there. They respond. And that's what didn't happen with Alice.
oh.
Yeah.
Do the
Amen.
EMPs, do they help kind of individualize that care? It sounds like since they've come in, they've added that extra layer in.
Yes.
Yeah.
Yeah,
Okay.
they would. So if you had a resident, maybe has gone without a physician, like normally that operator would have to take that person into the emergency room to renew prescriptions even, which is a pain,
Wow.
but we know there's thousands of people waiting for a doctor.
Mm.
Anyhow, they meet with each resident. They talk to them about their day. They talk to them about their mobility, any equipment needs they might have, any mental health needs they might have. We have a lot of people with mental health conditions
Hmm.
and any physical needs that are unmet. And then they work with the operator and the staff. And if there is a family physician, great. If not, they get one. And they work to modify the care plan so that everybody's on the same page and that the care can be as successful as possible. And again, it's about wrapping services around people.
I really like that approach of wrapping it around
Yeah.
because I find we have different levels, obviously, in Nova Scotia as well, but we are really putting people in boxes and they do really get moved from one to the next. So I really like that approach. It's really
Mm.
great.
And one of Kelly Lamrock's comments as well about the social workers was that government needs to equip the social workers with decision-making ability that when they were, because they're human beings. I mean, they're not somebody, that doesn't care. They do care.
Abs-
But if they're talking to someone about an elevated need and they say, well, I can't fit you in this, that, or whatever. I can't do anything for you. You're going to have to do this. And if they say, okay, I'll come and assess you, you'll have to go to a nursing home. Like we've got almost 200 people waiting for a higher level of care in level two now. I mean, it's just another, it's just a waiting game. It's not like when those needs increase, there's somewhere for people to go. There
Right.
isn't.
You're just stuck
So,
where.
right,
Mm.
right. So EMP is they've really, really made a tremendous difference. I recently did a survey of 135 operate owners and operators across the province, and they were the rock stars of the survey. I'll tell you, people were really happy. I mean,
Oh,
24/7, we can get them on the phone.
oh wow, that's
Wow. That's
Yeah,
amazing.
yeah. And we also have mobile X-ray now.
oh
So if
cool.
somebody, yep, if somebody falls, all of the homes that are physically accessible for this machine, which is a lot of them, if someone slips off the chair and they're a little sore, but they're not quite sure and they have osteoporosis and it's 2 o'clock in the morning and it's February, we don't have to send them by ambulance. If we're obvious, we know it's an emergency, obviously we call
Absolutely.
911. But there's so many occasions where people have been sent to hospital only to wait on a stretcher in a hallway for hours and hours and
My
hours and hours, only
goodness.
to find out that they're fine. So
Yes.
now this mobile X-ray comes to us and they come right in the building and take the x-ray and the person if they and then they consult with the radiologist and if the person has no obvious breaks they'll help put the person back in bed and or back in their chair and we'll follow up with the physician and the EMP nurse afterwards and that's another tremendous thing. So like I
Yeah.
say, we're not just room and board.
I was going
I
to
was gonna
say there's a
say.
huge variety of services. That's amazing.
Yeah, is special care homes living in 2030 or they're living in the future, I feel.
That's right.
Yeah, you
We
are.
also have another really great thing is, and this has been talked about in other countries across the world by a girl that helped us develop this from Beacon Clinical. Cheyenne Colbert is her
Oh, we
name.
know.
Oh, yes,
Yeah,
Cheyenne.
she's one of the
Mhm.
person-centered universe certified people. Anyway, she worked with me. We created TripAdvisor for special care, and if you go onto our website www.nbscha.ca, and there's also a francophone one, and you just click on residences, you can you can search. You can say, I want to live in St. John. I want to bring my cat. I smoke. I want to be 10 minutes from the bus stop. I want to live with people that are 30 years of age, and I want this and I want that. And it'll only generate the homes that have answered those questions. So we're about two-thirds of the way through getting all of the information on there, but every home is on there. So even at that, you can click on the region and you can click on the size of home and you can look at homes, see pictures, you can see their Facebook page.
Wow.
Some have virtual tours because the way that government responds, they helped us with that project and they're very excited that we're on our way to completing it. But right now, if your mom goes to hospital and you're a son that just flew in from Alberta and they say your mom's level two special care, here's the list. And you're in Moncton, there's 125 homes in Moncton.
Hmm.
So So what do? You start calling and start trying to make appointments, or maybe you just drive around and you pull in the driveway and there's dogs and chickens and you think that's not my mom. And then you go to another place and it's a big, beautiful Shannex or, big, beautiful building. And oh, this is my mom. And some homes charge extra, some homes don't. Some homes are model farms, and some homes
Mm.
are three people that live together with the operator, and some are 400, like 120 beds. So
Right.
it's all over the place, but that's really good. I think that's our strength because we are very diverse, but so are human beings, right? So
Yeah.
I
Yeah. It
was gonna
gives them
say, just
the
being
autonomy. Yeah, and it gives them the autonomy to make a choice. Like that is,
right,
sometimes like
right.
their last choice, like, where they're going to
That's
live.
right.
So, give them that because I know with other provinces they'll just put wherever there's an opening.
Yes.
So yeah, that's a beautiful
Yeah,
thing.
yeah. We have a shrinking sector, which is of a concern. I mean, if we were having this interview 8 years ago, I'd tell you there was 1,200 spaces, and now there's
Oh,
about 450.
oh yeah.
So that's a big concern, considering in 2030, I think the senior population over the age of 75 is going to go up like 40%. It's almost
It
going to
is.
double.
Yeah.
So, there's a lot of concern there, but we're hoping that the province has used the data they have to identify, what levels are people and where are they, and let's get some special care homes built in these communities because there are people ready they're shovel ready, but we've had no release of what the government calls a bed plan, which is again not a great word, but we need that bed plan, for lack of a better word, so that people can start constructing and get these done. And, they're a very, I mean, cost effective wise, and I love my nursing home people, but just to give you a quick comparison, if your mom lived in a memory care home and a special care home compared to living in a nursing home, it's about $6,000 a month more for your
wow.
mom, just for one person. So at a time when our province is trying to save money here, there, and everywhere, and running up against some strong opposition, for instance, the farmers, in the veterinarian scandal, that's $4 million. Well, if we take 100 people and move them into a memory care home instead of going to a nursing home and waiting for all that building to happen, and that's much more expensive. That's a unionized environment. I think it's like $46 million a year savings.
Wow.
So there's huge savings to be had, and it makes sense because care homes can build in every nook and cranny in this province, and they're heavily regulated. Like we're licensed, we're inspected. We can't go short-staffed. If we're short-staffed, we can lose our license. So we have to have the bodies, the people on the floor.
Mhm.
We're inspected by the fire marshal. We're inspected twice a year with public health. We have to report all incidents. It's a very, very rigid list of standards and procedures that we have to follow. So,
That's
and
amazing.
we have EMP now, and eyes in all the homes. So,
I was saying you just have layers. I love it. That
yeah,
is, that's amazing. And it adds that extra level of aging in place, like people that can't be at home. How can you make it as home-like as possible? And it,
yes.
like you guys are really doing a lot of good work around that.
Yes, we are.
Yeah.
One of the other differences, last thing I'll mention is, which we have a strong campaign coming out shortly, is the PSWs working in our homes are sitting around $20 an hour. And what's
Woo.
happening is we're losing people to the nursing home sector, the hospital sector, and other sectors because there's about an $8 an hour gap there. When
Wow.
you consider, and
Oh,
our staff have
really?
no sick time, no bereavement, no health and dental, no pension. None of that is included. So, operators are as good to their staff as they can be within their budgetary constraints, but we really need to get proper pay for the compensation for that group of people. And then we're going to have like our average age of workers about 55 years old.
Mm.
My mom still works in a care home and she's 80. She's a very young
Oh,
80.
bless.
Wow,
But,
bless her.
you
Yeah.
know,
Bless her.
yes, she sings and she does cooking and so on. But she's, an integral part of it. But anyway, we need to find a way to recruit young people into this field, and caring for seniors isn't always seen as the most like if you're a PSW and you can work in the emergency room, that's a little more sexy. Let's use that. But working with geriatrics and it's not as appealing to some.
Hmm.
But, if the wages were closer, then, we would have an opportunity for people to say, wait a minute, these residents are like my family now, and I have the same residents every day and the same team around me, and I have the ability to give medications and to help with insulin, but also to cook a nice meal that they enjoy and make muffins with them and take them to the doctor and take them for a walk around the property. And maybe I'm doing, a bath, and maybe I'm also cleaning a room, but I'm working with the resident while she dusts and I make her bed because she can't reach. So they do everything in the care homes. Um, it's very few care homes that would have segregated tasks.
Hmm.
And most people that go to work every day do like variety. So I think we have a very appealing occupation in special care homes. We just need to find a way for government to be able to support it bigger. And the Pay Equity Coalition has worked really hard on that. It seems the wage needs to be somewhere around $25 an hour to attract people into the field. So,
That makes sense. You want to, like you said, you want to have that equitable,
well, yeah.
yeah.
Prior to a big push that we put on for wages, I used to be the head of the Human Services Coalition as well. I was the CEO for that, and we fought primarily for wages for people in the community and social
Hmm.
services sector. Prior to that, which was only um, 2018, our staff made minimum wage.
Mm.
So
Yeah,
government has come a long way. They pay almost a little over $9 an hour towards our wages. But in 2018, you could go to work in my care home and have all of the things that you have to do and incontinence and all of these maybe unpleasant,
right.
some of these unpleasant things, or you could go work at Tim Hortons or pump gas. It was the same
Yes.
money. So at least today we're sitting about 450 over minimum wage, but still it's not enough. But
Still not enough, absolutely.
but we work hard on our culture, and I think and with these supports with extramural as well, staff don't feel like they're navigating, on their own. I mean, they always had operators and their team members, but now they have that clinical person right alongside them,
That's
helping to relieve some of that stress. It's like, is she okay or isn't she okay? As a
yeah.
PSW, you're not looking at it the same as a nurse.
Mhm.
No.
Yeah,
No.
sometimes you just need to say it out loud to somebody and have that
Hmm.
reassurance that you're doing
Right,
the right thing.
right.
Well, thank you so much. It's been so enlightening, and I can tell there's a lot of really great work going on with your teams and the teams you're working with. So we really appreciate you taking the time to chat with us today.
Thank you. It was a
Yes.
great
Yeah.
opportunity. I enjoyed it. Call anytime.
Yeah.
Absolutely.
Not the traditional, yeah, not the traditional kitchen table, but there's some tables in front of us at least.
Yeah.
Yeah.
Awesome. Thanks so much,
All right.
Jan.
You're
Thanks so
welcome.
much, Jen. Have a great
Okay, but
one. Thank
you too.
you.
Bye bye.
Bye.